Chapter 26, Fluid and Electrolytes. Now we're shifting gears and looking at electrolytes. The principal extracellular fluid electrolytes are sodium and chloride. The principal intracellular fluid electrolyte is potassium. There are other significant electrolytes as well. They're calcium, magnesium, and phosphorus. All right, we're going to start with potassium. It's the most abundant positively charged electrolyte within the cells. 95% of the body's potassium is inside the cells, but we can't measure it easily inside the cells, so we measure it in the blood. Potassium in the blood should be 3.5 to 5 milliequivalents per liter. Potassium levels are critical to normal body function. Where do we get it? Fruit juices, fish, vegetables, poultry, meat, dairy products. We talked about this with Chapter 25. If the person eats too much and their kidneys work, it's excreted through the kidneys. However, if their kidneys are impaired in any fashion, eating too much potassium can lead to possible toxicity, very high levels of potassium and toxicity reactions. Potassium is responsible for muscle contractions, transmission of nerve impulses, regulation of the heartbeat, maintenance of acid-base balance, and many other functions in the body. Why do we give it? To treat or prevent potassium depletion when dietary means are inadequate. What does that mean? We give it by IV because for whatever reason we can't get enough into them by mouth. Hypokalemia is serum levels less than 3.5 milliequivalents per liter. It can be from excessive loss rather than a poor dietary intake. We can get it from burns. Now, people who are severely burned can either have very low or very high levels of potassium, so you have to check this. Loop and thiazide diuretics can cause hypokalemia, as can vomiting and diarrhea, crash diets, and there are always other reasons for it. Hypokalemia in the presence of digoxin therapy can cause digoxin toxicity, resulting in serious ventricular dysrhythmias. So we need to be very careful when someone's potassium level is low. We're checking their heart. What are the adverse effects of giving potassium? Well, if you give it by mouth, it's very irritating. It can increase the problems with diarrhea, nausea, and vomiting, GI bleeding, ulcerations. Well, we just said that one of the reasons people get hypokalemic is from severe diarrhea and vomiting. If we give it by mouth and it causes diarrhea and vomiting, we've just made things worse. IV administration, again, this stuff is very irritating and it can be very painful. And they can end up getting phlebitis at the site if we give it IV. If we give too much, we're looking at hyperkalemia and toxic effects. So what is hyperkalemia? It's potassium levels in the blood over 5.5 milliequivalents per liter. We get it by, potassium supplements. Well, that would be if the kidneys aren't working well enough to flush it out of the system. Kidneys not working well. Excessive loss from cells. Well, if it's lost from the cells, it goes into the blood next to be taken out of the blood. So that's why it would be too high. And one of the ways that can happen is from burns or trauma. Potassium-sparing diuretics can cause hyperkalemia, as can metabolic acidosis, hyperaldosteronism, and some infections. Hyperkalemia. Well, again, we'll get some muscle weakness. The muscles aren't working appropriately, so they're weak. That includes the heart, so we'll get some irregularities, including ventricular fibrillation and cardiac arrest. How do we treat it? We can give some IV medications. We can give a drug called K-exalate, or at times we might need to do hemodialysis to remove the excess potassium. Sodium is the most abundant positively charged electrolyte outside the cells. Normal concentrations outside cells are 135 to 145 milliequivalents per liter. And we maintain this through dietary intake of sodium chloride. Salt, fish, meats, foods flavored or preserved with salt are common sources, as well as almost all processed foods are high in sodium. Sodium is responsible for control of water distribution. That's one of its major causes, major responsibilities. You know, it maintains the fluid and electrolyte balance. It also participates in acid-base balance. Why do we give it? We give it to treat or prevent sodium depletion when we can't do it well enough by mouth or through the regular diet. If it's a mild sodium depletion, quite often we'll give it to them by mouth. We'll give them a supplement by mouth. Or we could restrict fluids. Severe sodium loss, we'll treat it by IV saline or lactated ringers, which contain saline. Hyponatremia is the name for low sodium, and it's levels below 135 milliequivalents per liter. The person may be lethargic, have stomach cramps, hypotension, vomiting, diarrhea, and seizures. Causes. Same thing as hypokalemia, but also a cause is excessive perspiration, prolonged diarrhea and vomiting, or renal disorders. What are the adverse effects of giving sodium? Well, if we give it orally, nausea, vomiting, and cramps. If we give it IV, venous phlebitis. Hypernatremia, too much sodium in the system. That's greater than 145 milliequivalents per liter. Symptoms: water retention. That means big time edema and hypertension. Red, flushed skin. Dry, sticky mucous membranes. Increased thirst. Elevated temperature. Decreased urine output. The body is trying to thin out the blood. Causes: poor renal excretion stemming from kidney malfunction. The kidney's not working, it's not getting rid of the sodium. Or dehydration and the person's just not drinking enough fluid.